In the fight to slow the spread of the Delta variant, 77% of ICU beds nationwide are full as COVID infections continue to surge. Deaths are also spiking, up 155% in the past month. And just last week, booster shots were approved for people with weakened immune systems. Joining me to talk more about this is Dr. Ulysses Wu, the System Director of Infectious Diseases with Hartford Healthcare. Dr. Wu, thank you so much for being with us.
Thank you for having me.
So like I just mentioned, booster shots approved for people with weakened immune systems. This is, of course, bringing about a whole new set of questions from folks. Why should immunocompromised people get that third shot?
Well, the studies have shown that immunocompromised people may be at the greatest risk for not only contracting COVID, but also suffering complications from the COVID virus itself. And so it is important to get their immune system tuned up as best as possible.
Proof of being immunocompromised is not necessary, but if people are watching and they have a certain condition, what kinds of illnesses would pertain to immunocompromised?
Well, the main things that we would certainly look for, and you're absolutely right, the term immunocompromised is a very broadly defined set of criteria. But specifically, we would be looking at those who are, for example, undergoing active chemotherapy, those who may have an active hematologic malignancy, such as leukemia, those who have had a history of transplants, either solid organ or hematologic, or those who have been on immunosuppressive meds, certain immunosuppressive meds, not all immunosuppressive meds, but certain ones that would meet that criteria.
There are obviously plenty of Americans who do not have weakened immune systems. Do you think they will need booster shots or that third shot eventually?
So there are two reasons to get booster shots. Number one is your immunity. And so in the immunocompromised, we know your immunity is lower. We've yet to see decreasing immunity associated with the vaccines or the COVID vaccine, though the earlier literature suggests that their immune systems may be waning 6, 9, 12 months. It depends. So you may need a booster for that. But the second reason would be the presence of variants. And I wouldn't necessarily call it a booster, but a completely new shot for a variant where the vaccine doesn't work against. Fortunately, it works against the Delta at this point.
Well, that is definitely good to hear. I also want to ask you this, because this is something that a lot of friends and family have been talking about. If you did get the Pfizer vaccine, does that mean that your third shot or your booster shot also needs to be Pfizer, or can it be Moderna or vice versa? And same goes for if you got the J&J shot.
That's a very good question. Right now, unfortunately, you have to get the vaccine that you got the vaccine with before. I think down the road, and some of the literature supports that there may be able to mix and match some vaccines, but right now you got to get what you get. And with J&J, unfortunately, there is no booster that is recommended at this point.
School starting, Dr. Wu, in just a couple weeks. Obviously, the mask mandate here in Connecticut going through the month of September. So many students will be wearing a mask in school, regardless of whether they've been vaccinated or not. I want to ask you about children under 12. Right now, there is no vaccine available for them. Is there any new guidance for them or any time frame on when one may become available?
So time frame, it depends. Glasses half empty, probably not until next year, maybe early next year. Glasses half full, hopefully towards the end of the year. There is no guidance, but I want people to look at our protection as layers of protection in totality. So it's not just about the vaccine or masking or social distancing. It is all of them. It is social distancing, masking, vaccinations, as well as our social behaviors. And if you can't get the vaccine, what you want to do is you want to you really rise up and use all of the other ones. And personally, what we want to do is we want to extend our own personal bubbles to those around us who may not be able to get protected. So you yourself, if you have kids, you also want to get vaccinated. You also want to mask up when you're in certain situations, and you don't want to put yourself in dangerous, risky social behavior situations.
It makes sense. A lot of good information there. Dr. Ulysses Wu, as always, thank you so much for being with us. We appreciate it.
Thank you for having me.